You won't believe the hidden side effects of gabapentin that doctors never tell you about. Stay tuned until the end. I will give you a case study about a friend of mine taking gabapentin, and you might be surprised. A medication that's been seeing a significant increase in prescriptions lately. But what you may not know are the potential dangers lurking behind this seemingly harmless drug. Gabapentin is commonly prescribed for various conditions like nerve pain, seizures, and even anxiety. However, what many people are unaware of are the lesser-known side effects that come along with it. Today, we're going to shine a light on these hidden risks. Let's talk about the common side effects of gabapentin that can impact individuals taking this medication. Imagine you're a little kid spinning around and around, and then you suddenly stop. That's kind of what it feels like when you take gabapentin. Your head might feel like it's spinning, or you might feel like you're going to fall over. It can make it hard to walk straight or do other things that need you to be steady on your feet. Another one is gabapentin can induce profound drowsiness, causing a strong desire to curl up and nap. This medication often leads to extreme tiredness, making it challenging to remain alert and focused, whether engaging in playtime or attempting to concentrate on homework. Gabapentin may provoke a significant increase in appetite, even shortly after eating. This heightened urge to eat can lead to consuming more calories than necessary, potentially resulting in weight gain. It's akin to craving dessert after a satisfying meal, despite feeling full. Taking gabapentin can cause visual disturbances, similar to trying on someone else's glasses. Objects may appear blurry or unfocused. This medication can interfere with your ability to focus your eyes effectively, making tasks like reading or playing games more challenging. Fortunately, not everyone experiences these side effects, and they often diminish as your body adjusts to the medication. If you do encounter these symptoms, it's essential to inform your doctor promptly so they can provide appropriate guidance and support for managing them effectively. Beyond the common side effects, there are more severe risks to be aware of. Mental health impacts such as depression, suicidal thoughts, and even an increased risk of developing addiction are all potential dangers associated with this medication. The long-term effects of gabapentin can have serious implications on both physical and mental well-being. Gabapentin, while effective for managing certain medical conditions, can have significant impacts on a patient's mood and emotional well-being. One of the potential side effects is an increase in anxiety. This can manifest as persistent worry or nervousness, which may not be tied to any particular event or situation. Patients might find themselves feeling on edge, restless, or experiencing a sense of impending doom that they cannot easily shake off. This heightened state of anxiety can interfere with daily activities, making it challenging to focus or relax. In addition to increased anxiety, some patients may experience depression while taking gabapentin. This can present as a pervasive feeling of sadness or hopelessness that persists over time. Patients might lose interest in activities they once enjoyed, withdraw from social interactions, or struggle with feelings of worthlessness or guilt. Depression can also lead to changes in sleep patterns, appetite, and energy levels, further impacting overall quality of life. These mood changes can be particularly concerning because they might exacerbate pre-existing mental health conditions or contribute to new ones. For instance, someone with a history of depression might find their symptoms worsening while on gabapentin. Conversely, an individual who has never experienced significant mood issues before might find themselves grappling with these challenging emotions for the first time. It's important to note that these mood changes can vary widely in intensity and duration. Some patients might experience mild and temporary fluctuations, while others could face more severe and prolonged episodes. The unpredictability of these side effects can add an extra layer of stress and uncertainty for those taking the medication. The exact mechanism by which gabapentin affects mood is not fully understood, but it is believed to be related to its action on the nervous system. Gabapentin influences neurotransmitters, which are chemicals that transmit signals in the brain. By altering the balance of these chemicals, gabapentin can inadvertently impact mood and emotional regulation. Given the potential for these significant mood changes, it is crucial for patients to monitor their emotional state closely while taking gabapentin. Keeping a diary of mood patterns, noting any drastic changes or persistent feelings of anxiety and depression can be helpful. This information can provide valuable insights for healthcare providers in assessing the impact of the medication and making necessary adjustments to the treatment plan. Patients should feel empowered to discuss any mood changes with their healthcare provider openly. It is essential to communicate any concerns or experiences of anxiety or depression promptly. In some cases, adjusting the dosage or switching to an alternative medication might be necessary to alleviate these side effects. How about kidneys? Gabapentin is a medicine that helps some people feel better, but it can be tricky if you have problems with your kidneys. Your kidneys are like filters in your body that help clean your blood. When you take gabapentin, it can affect how well your kidneys work. It's like trying to balance on a tightrope. Sometimes the medicine can help, but if your kidneys are not working well, it might not be safe to use gabapentin. That's why doctors need to check how your kidneys are doing before giving you this medicine to make sure it's safe for you. Now, what about diabetes? The most common disease in the world. Now, diabetic nephropathy is a condition that affects people with diabetes and can harm their kidneys. When someone with diabetic nephropathy takes gabapentin, it's like walking a tightrope. The medicine might help with their symptoms, but it can also affect how well their kidneys work. Doctors need to be careful and check how their kidneys are doing before giving them gabapentin to make sure it's safe and won't cause more problems for their kidneys. There is a case study of a friend of mine taking gabapentin I would like to share with you guys. Sarah, a 68-year-old retiree, had been struggling with persistent nerve pain in her legs for years following a bout of shingles. Her primary care physician had prescribed gabapentin, assuring her it was a safe and effective medication for managing her neuropathic pain. At first, the gabapentin seemed to help, and Sarah was relieved to finally find some relief. However, over the next few months, she began to notice some concerning side effects. She felt increasingly dizzy and unsteady on her feet, often having to hold on to furniture to keep from falling. Her normally sharp memory also started to fade, and she found herself forgetting simple tasks and conversations. Concerned, Sarah mentioned these issues to her doctor, who brushed them off, telling her the side effects would likely subside as her body adjusted to the medication. Trusting her physician's advice, Sarah continued taking the gabapentin as prescribed. Unfortunately, Sarah's condition only worsened. One afternoon, while walking to the kitchen, she suddenly lost her balance and collapsed, hitting her head on the counter on the way down. She was rushed to the emergency room, where tests revealed she had suffered a mild concussion. It was then that the doctors made a startling discovery. Sarah's kidney function had deteriorated significantly since starting the gabapentin. The high levels of the medication in her bloodstream were causing a dangerous buildup, leading to the dizziness, confusion, and ultimately, the fall. Horrified, Sarah's family demanded the gabapentin be stopped immediately. Over the next several weeks, as the medication slowly cleared her system, Sarah's cognitive abilities and balance gradually improved. However, the damage had been done. She would require physical therapy to regain her strength and confidence in walking. This harrowing experience served as a stark reminder of the risks associated with gabapentin, particularly for older adults with underlying health conditions. While the medication can be effective in treating neuropathic pain, it requires careful monitoring and dose adjustments, especially in patients with compromised kidney function. Sarah's story underscores the importance of open communication between patients and their healthcare providers, as well as the need for vigilance when it comes to managing the potential side effects of any medication. By staying informed and advocating for their own health, patients can help ensure they receive the safest and most appropriate treatment for their individual needs. It's crucial to understand the potential challenges that may arise when using gabapentin to ensure the best possible outcomes and maintain a high quality of life. These real-life experiences shed light on the harsh realities of using gabapentin and the profound impact it can have on individuals and their loved ones. These issues can significantly affect a person's quality of life. It's crucial to understand the potential challenges that may arise when using gabapentin. You can also check out my other video that talks about 11 fruits that cleanse your kidneys fast. We want to hear from you. Share your experiences below in the comments below and turn on the notification bell.